Hello everyone. Now we are going to start a topic respiratory disorder under which there is a subtopic asthma. What is asthma? Asthma is a chronic inflammatory disorder of bronchial trees in which breathing is periodic, rendered by difficult by narrowing of bronchi. It is clinically characterized by recurrent episodes of wheezing, breathlessness, tightness of chest, and cough. Asthma is common, but it is relatively a rare cause of death. It usually develops at night or early morning. The basic characteristics, there are three basic characteristics: episodes of bronchial constriction, inflammation of bronchial walls, and increased mucus secretion. Here comes the classification. The asthma is classified into two categories according to the type of antigen and according to the agents that trigger bronchial constriction. Under the type of antigen, there are two types: atopic, which is allergic, and non atopic, without allergic sensitivity. Under trigger of bronchial constriction, it is due to seasonal, exercise induced, drug induced, occupational asthma, and smokers, that is, asthmatic smokers in The most common type of asthma is atopic, non atopic, drug induced, occupational. Now we are going to study them one by one. Atopic asthma. It is the most common type of asthma which usually begins in childhood. Family history of asthma or allergic diseases like asthma, urticaria, and hay fever is common. The example of type 1 IgE mediated hypersensitivity reaction and exogenous substances, that is allergen, causes asthma can be recognized. Triggering the environmental allergens like dust, pollen, food, animal dander, etc. Skin test with causative allergen results in immediate wheal and flare reaction. Now comes non-atopic asthma. No causative exogenous factors can be identified and it does not show allergen sensitization. Skin tests are usually negative. Family history is less common. It may be due to hyperirritability of bronchial tree. Triggering events can be of two types, that is respiratory infection due to viruses like rhinoviruses, parainfluenza viruses, and inhaled air pollutants like smoke and fumes. Now come the drug induced. Many drugs may trigger asthma. Example, aspirin induced asthma. Aspirin inhibits cyclooxygenase pathway of arachidonic acid of metabolism, produces leukotrienes. Leukotriene is a bronchoconstrictor which causes asthma. Occupational asthma. The triggering occupational agents like fumes, epoxies, rinse, organic chemical enders like wood, cotton, gases like toluene, other chemical substances like penicillin products. Now we will discuss the etiology. Under etiology, we are going to study about three etiology, that is endogenous factors, environmental factors, hygiene hypothesis. First, the endogenous factors, under which we are going to study about genetic predisposition. Major etiological factor in atopic asthma is genetic predisposition to type 1 hypersensitivity reaction and exposure to environmental trigger. One of the susceptibility locus is on the chromosome number 5, with several genes are involved in regulation of IgE synthesis, mast cell and eosinophils growth and differentiation. Airway hyperresponsiveness. It is an abnormality in which there is an excessive tendency for airways to contract too easily in response to multiple inhaled triggers that usually does not have any effect on normal individual. In gender, more common in boys than in girls, and after puberty it is more common in female than in men. It mostly begins at before the age of 24. Now come the environmental factors. There are several stimuli that trigger the asthmatic attacks. Inhaled allergens like dust, mice, household pests causes asthma in early childhood. Upper respiratory infections like rhinoviruses, coronavirus. Air pollutions like sulfur dioxide, nitrogen oxides, diesels, particulates, ozone. Passive smoking causes asthma. Drugs, example like beta androgenic blockers and aspirin. Now come hygiene hypothesis. It proposes that individuals that lack of infection in early childhood are more prone to asthma than in children who brought up on farms who are exposed to high level of endotoxins. Now we are going to discuss about morphology. There are two types of morphology, that is gross morphology and microscopic morphology. In gross morphology, we are going to discuss airways, that is bronchi and bronchioles, occluded means obstruction, occluded by the plug of thecus, thick and tenacious mucus. In patients who die due to status asthmatis, the lungs are greatly distended due to overinflation and show small area of collapse. Status asthmatis is the most severe form of asthma. Severe acute paramox persists over days and even weeks. Severe inflow of air obstruction causes cyanosis and death. Microscopy. Under microscopy, we are going to discuss first about the increased amount of mucus from mucus plug. It contains desquamated epithelial cells and eosinophils and form the spiral shaped cast of airways, which are also called Krushman spirals. They are also found in the sputum. Now comes the inflammation. The numerous eosinophils are found in the walls of bronchi and bronchioles. Charlotte Leyden crystals, which are the crystalloid derivative from the eosinophil lysophospholipase binding protein called gelatin 10 and are also found in it. There is also edema and the congestion of the airways. Airway remodeling. First, an increase in number of size and number of submucous gland, hypertrophy or hyperplasia of bronchial walls and smooth muscles. Second, increased vascularity, deposition of subepithelial collagen accompanied by fibrosis and thickening of basement membrane. Now comes the clinical course. Clinical course. Acute asthma attack up to several hours. In some mild degree of chest tightness, dyspnea, wheezing and cough with or without sputum production